Come on, students. Excuse me, sir.
Good morning, Doctor.
Good morning, sir. Okay, they are second year MBA students. Guys, please introduce your disease.
Okay, welcome. What's your name?
My name is Mangesh Dal. What's your age?
I'm 68 years young.
What's your complaint?
Madam, actually I've been having fever for past 4 to 5 days, madam. Sir, ladies,
So there are doctors. You can tell them.
madam, sir, I had urine problems, sir. When I was passing urine, it was burning and nothing was coming out.
Since when you are having this body sensation?
For past 4 to 5 days, sir.
When were you admitted to the hospital?
I came yesterday.
Okay, now let me learn all the aspects of UTI so that history taking is easier.
Hello, my name is B.D. Chaurasia and I'm going to be talking about the anatomy of the urinary system. The urinary system consists of a pair of kidneys, ureter, bladder and urethra. The kidney filters the urine and it enters the bladder via the ureter. The bladder fills and the detrusor muscle stretches and the muscle contracts during voiding of urine. What is a UTI? It is an infection of any part of urinary tract, the kidney, the bladder or the urethra. It most oftenly is caused by bacteria. It is more common in women because of the shorter urethra and it more commonly involves the bladder, urethra, but serious infections can involve the kidney.
Now, let us see the types of UTI. Based on anatomical sites, urinary tract infections are classified into lower and upper UTIs. Lower UTIs are more common and involve the urethra and the bladder. Upper UTIs are less common and involve the kidney and the ureter. Based on the source of infection, UTIs can also be classified as hospital-acquired UTI and community-acquired UTI. Hospital-acquired UTI are infections of the urinary tract that occur in the healthcare facility, and it occurs more than 48 hours after hospital admission. Community-acquired UTI are infections of the urinary tract that occur in the community and occur less than 48 hours of hospital admission.
Hello, I'm Panikar and I'm going to be talking about the etiology of UTI.
The most common causative agents of community-acquired UTI are E. coli at 66.6% of cases, followed by Klebsiella pneumoniae, 16.6% of cases, and others such as Enterobacter, Enterococcus, Pseudomonas, Citrobacter, and Saprophyticus. Other microorganisms are Candida, Staphylococcus, and Streptococcus.
Hi, this is Robbins, and I'm going to talk about the pathogenesis of urinary tract infections. UTI is developed by either ascending or descending bacterial invasion into the urinary tract. The more common mode of infection is the ascending pathway, where fecal flora gain access to the urinary tract via colonization of the urethra. Rarely, a UTI occurs by the way of descending pathway. Descending infections are the result of heterogeneous spread of bacteria from a primary source located elsewhere in the body. Now let's look at the stages of UTI. First, we have the colonization stage, where the bacteria colonizes the urethra and descends towards the urinary bladder. Next, we have the uroepithelium penetration, where the bacteria penetrates the bladder and replicates there and possibly forming a biofilm. The third stage, we have ascension stage, where the bacteria further ascends towards the kidney via the ureters. And the fourth stage, we have the pyelonephris stage, where the infection of the renal parenchyma occurs, which leads to inflammation. And the fifth and the final stage, we have acute renal injury, where the bacteria starts populating through the kidney, leading to kidney injury.
Signs and symptoms: upper UTI, fever and chills, flank pain, abdominal pain; lower UTI, cloudy urine, foul odor, suprapubic tenderness. In both UTI, frequency and urgency are common.
UTIs are more common in females than males. Some of the possible risk factors are diabetes, a weakened immune system, menopause, pregnancy, or urinary retention. Other factors include sexual activity and poor personal hygiene.
Diagnosis includes sexually transmitted diseases like gonorrhea and chlamydia, which cause painful urination and discharge from urethra, vaginitis, causes burning, itching, and discharge, not involving the urinary tract, but symptoms can be similar to burning and discomfort of UTI. Diabetes, one of the main symptoms of undiagnosed diabetes is frequent urination with large amounts of urine. Cancer, although not as common, some types of cancer like bladder and kidney cancer can have similar symptoms as a UTI. Prostatitis causes pelvic pain with urination and increased urinary frequency in men.
Lab diagnosis. Urine can be collected by 3 methods. Urine sample should be processed immediately without delay. If there is a delay, then it should be refrigerated or can be stored by adding boric acid for maximum 24 hours. Direct examination. Wet mount, glucoside esterase test, nitrate reduction test, and gram staining. Culture. The most commonly used culture media are blood agar and McConkey agar, CLED. Also, there is scarce concept of significant bacteriuria where the sterile urine is contaminated during voiding.
Complications of urinary tract infections. Some of them are pyelonephritis, kidney damage, sepsis, which could lead to organ damage. Recurrent UTIs could cause narrowing of urethra, and when UTIs occur during pregnancy, there is a risk of preterm birth and low birth weight.
Hi, I'm Katie Tripathi, and I'm going to be talking about the treatment of UTI. General measures in treating a UTI include maintaining high urine flow rates and frequent bladder voiding by increased intake of water, and neutralizing the urine by giving a urine alkalizer. A urine culture along with antimicrobial susceptibility testing is given. In cases of severe infections, empirical antimicrobials can be started. The empirical antimicrobials are ciprofloxacin, ofloxacin, cotrimoxazole, cefalexin, amoxicillin and clavulanic acid, and nitrofurantoin. Further, the antimicrobials are adjusted according to the susceptibility of the organism. Urinary antiseptics, nitrofurantoin and methenamine are also prescribed. The other antimicrobials used are quinolone, ampicillin, piperacillin, cephalosporin, gentamicin, chloramphenicol, and tetracycline. Prophylaxis is also given to some groups of people, including women of reproductive age group who have recurrent cystitis, patients with prolonged catheterization, patients with uncorrectable abnormalities of the urinary tract, and patients with chronic obstruction which causes urinary stasis.
Hello, my name is Park and I'm going to be talking about prevention of UTIs. Prevention of UTI. Stay well hydrated, dilutes the urine and lowers the concentration of bacteria in the bladder. Wipe front to back, prevents bacteria from the anal region from spreading to the vagina and urethra. Empty your bladder frequently to ensure that urine is not sitting in your bladder for long periods of time and prevents growing of bacteria.
The prevalence of community-acquired urinary tract infection in a study done in India in 2022 was found to be 10.1% with a rate of 12.8% in pediatrics and 87% in adults. Females were predominantly affected, followed by males. A clinical examination of the suspected cases showed culture positive in the samples taken from males 35% and females 37%. The females tend to be in the reproductive stage.